I just didn't want to look in the mirror anymore. Was not happy with how I presented myself every day.
That operation became even more popularized where some celebrities underwent the procedure.
Well, the satisfaction rate with facelifts is huge, wouldn't you say, Orly?
Absolutely. It's life-changing.
Nose jobs, people talk about it amongst their age group. With facelifts, people are private about it. So not everyone
Not
knows
me.
who's. You're not. You're
not. You're an exception and a wonderful exception.
We have a few exceptions.
Yeah.
Hey guys, it's Dr. Solomon and welcome back to UnPhiltered. This is our podcast where we talk about things about plastic surgery in an unfiltered way. And today we have a special guest, one of our patients who's undergone a deep plane facelift. And we have Nancy from our office who's going to be helping ask some questions. We're going to dive into the topic of facial rejuvenation surgery.
So let's talk about the deep plane facelift and facelift surgery. For those who don't know the difference between a facelift and they think deep plane facelift is different than facelift, they're actually one of the same, just a different technique. Dr. Solomon, do you want to share with us what the deep plane facelift technique is and how does it differentiate from previous techniques?
Facelifts in general refer to lifting the soft tissues and the skin of the face and reversing some of the gravitational descent of the face that occurs as you get older. The more standard facelift would involve elevating a lot of the skin and pulling it back and removing some skin and stitching it around the ears. That was the basic facelift. And then there was an identification that lifting the deeper structures known as the SMAS layer significantly improved the surgical outcomes. And for decades now, people have been lifting the SMAS either with suture suspensions, like underneath the skin, or by actually lifting a little flap of that SMAS, pulling on that and sewing it almost like a 2-layer closure. And that was known as a SMAS flap. And then it became something called an extended SMAS flap, where people were lifting that second flap a little further, pulling it back and redraping it. What some surgeons identified and noticed, and this is about 25 years ago, right around the time that I actually started practice, I went to Los Angeles to visit a very well-known surgeon at that time, Dr. Kamer, as an observer. And Dr. Kamer was the guy, one of the top celebrity Hollywood surgeons of the time. And he had switched over with another surgeon named Dr. Hamra. They were sort of the two guys who were talking about deep plane facelift surgery. Dr. Hamra wrote books about it and would lecture about it. But Dr. Kamer similarly had adopted that and modified his technique. So I thought there must be something to it if this famous surgeon's doing it this way. So and he was having other people coming and watching and visiting. But it wasn't the type of technique that you could just sort of switch over and start doing. There were some nuances to it because working in that deep layer can be dangerous. The facial nerve, which controls all the movement of the face, is literally within millimeters of that layer. And so you have to be very comfortable modifying that layer in a relatively aggressive manner. And that operation became even more popularized where some celebrities underwent the procedure. In New York City, a very well-known surgeon, Dr. Giacano, who's roughly around my age, who I know, and I've visited and watched him do the operation, did the surgery, I think, with Marc Jacobs, and there was a big spread on this. He was very public about it, which really sort of put it, I think, out there into the media space and social media where everyone became sort of aware of it. That being said, when I would go to medical conferences as recently as 10 years ago, there were surgeons who are well known saying it makes no difference, a deep layer facelift, not the deep layer, the deep plane versus the extended SMAS lift. And there was sort of debate about it. Now it's funny, many people are marketing that terminology. They're using that they all do deep plane. In Toronto, I think I was one of the first people sort of saying, hey, I do deep plane lifting. Now I think there's dozens of surgeons saying they do that technique. And again, we don't all go watch each other's surgical technique. I try to post what I do. So surgical videos, while they may gross people out, I think it gives people
they actually see that you are doing it.
That we're actually doing sort of what is being done in other jurisdictions like in New York and LA.
Because I was going to say, how do patients know? Like patients are, they look at marketing. They're none the wiser. They're not super educated to know what the difference is between these techniques. They go in for, it's like we take your car into a shop. You don't really know what the mechanic's doing.
Yeah, you don't know. But the thing is that you can get nice results with doing the conventional lifting as well. So the big advantages of this procedure is that they look natural. They look less pulled, less stretched, more natural. There's debate as to whether the longevity of them is a little bit better versus the conventional lifting. And so those are big things. So, for those of us that have adopted it, it's very rare for us to go backwards and switch back to our old techniques. So in my mind, I can't imagine why I would switch techniques back to the way I used to do facelifts, which was the extended SMAS flap. I have the odd case that I'll do that way, but it's usually for revision type of surgery. So again, in my opinion, in my hands, I feel like my results have gotten better. I think the results have better longevity. And I think that the results look a bit more natural. And that doesn't mean they're all perfect. No, sometimes we have to tweak and modify like any other operation. But the touch-up rate from procedures and the satisfaction rate, I think, has improved with this technique.
Well, the satisfaction rate with facelifts is huge, wouldn't you say, Orly?
Absolutely. It's life-changing. I said this before on one of the Instagrams that I've done with you. I said, I wish I would have done this at least 10 years sooner.
Well, that's interesting that you say that, because I would say that the bulk of our, not the bulk, but a majority of our patients now that are seeking facelifts, I would say the sweet spot is between 53, 57. We see people at 48, 49, we see 51, 52, like all in that range, but the most common has become the middle of their 50s. And I think it's just we're living in a society where it's an anti-aging society and people want to look young while they feel young and feel good. And we have social media and it makes people feel like they want to put themselves out there and they want to look good when they put themselves out there. I think there's multiple reasons. I think COVID changed a lot too. I think during COVID, it was like a boom. People were on Zoom. And then there was a boom because people saw their faces. They actually don't know how to hold a camera. If you hold the camera at eye level, you won't see the underlying of your chin. But when they're putting it on a desk, all you do is see upwards on your face. So I think people didn't like what they were seeing. And we started seeing a lot more people seeking facial rejuvenation.
Totally. And I think also that the decade of the 50s is really the third chapter of your life. So, I kind of feel like I gypped myself of 10 years of feeling better about myself. And listen, I'm thrilled and very, very happy, but I do wish I'd have done it sooner.
That's interesting. Well, I don't think you're alone. A lot of people seem to say that now, especially because we sort of have two generations merging where some people are doing it at your age and they're like, I could have done it earlier. And then those that are currently in their 50s who are, coming and feeling emboldened to do it at an earlier age. And then everything's always influenced by what's going on in the media. So, we see, the media likes to popularize like botch stuff that goes badly. Like I remember Demi Moore had a facelift and looked like kind of stretched and pulled, but she probably was very early on after her procedure. And now you see pictures of Demi Moore and you see her social media and I follow her
amazing.
And she looks unbelievable.
She looks amazing.
Beautiful.
She does.
Yeah, it's
And natural.
Yeah, she looks like really like.
She's one of the better ones that I've seen.
She looks terrific. But again, it's a process. So probably she looked a little bit strange in the early days after. And that's what the media jumped on, not that she just looks amazing for her age now. So anyway, I think it's great that you did it. And I'm glad that you found us and that you put your trust in me to do your surgery.
I was mention trust because that is a huge thing. People come in, we meet them in consultation. They have to decide, do I trust him or do I want him to, do my surgery? They're often most concerned, am I going to look natural? Am I going to look like myself? And then they just have to, it's really important that they connect with Dr. Solomon, that they feel that they're heard, that he knows what they want and what they're going to look for. But, we give the analogy about being on an airplane because on surgery day, patients come in and they're both anxious and excited. And it's like going on an airplane. You're trusting the pilot. It's kind of like out of your control. You're trusting the team. And that's what you are. You're a pilot driving the plane and people have to really trust you. So it's really, it's a privilege. It's quite the privilege.
It is a privilege.
Yeah.
But I have to say that, not knowing you and not knowing anyone that used you, I had to totally depend on my instinct.
Yeah.
When I had the consult with you.
Yeah.
And
well, it's super interesting because we find certain people are with nose jobs, people talk about it amongst their age group. With facelifts, people are private about it. So not everyone
Not
knows
me.
who's. You're not.
You're not. You're an exception and a wonderful exception.
We have a few exceptions.
Yeah,
We've had a few people
for
who
sure.
are like sharing their stories with us
Yeah.
on Facelift
Well, I really
journeys,
want
for
to
sure.
encourage, men and women to do this and not be, not think that it's, it can be catastrophic, which it can, but not if you're with a surgeon that you trust and, you've done research on, which is so important.
Yeah, absolutely. It's not to
And you're
be
so,
taken
you know
lightly.
what? You are so disarming. As soon as I met you, that was the feeling I got from you. And your expertise in the field, the number of years you've done what you're doing and how many you've done of what I was interested in, it just all came together and, told me that you're my guy.
That's nice. Listen, I'm glad you chose me. Within Toronto, we happen to be in a big city with, one of the biggest cities in North America. There's certainly a number of competent, good surgeons around in Toronto that are doing this type of work. I do feel like I'm in that sort of sweet spot now. 25 years into practice, have lots of experience, and I've done hundreds and hundreds of cases where you sort of get just better at doing the procedure with time. So right now, sort of we're very, very busy. It's like a bit of an analogy of like an athlete, but she laughs at me when I say it. But I do think that you sort of in surgery develop, and then you peak, and then you try to maintain. I have a colleague who just retired at 80. So he started, a big compliment to me is that he sent me a facelift last week, who everything's gone beautifully for. And just before she went to sleep, she said, "I want you to know I was sent by this colleague," which was, a big compliment.
Absolutely.
He trusted me with one of his patients.
Yeah. Yeah.
This week was actually interesting in the clinic because we had a lot of facelifts, and we had, I think there was 2 instances where one person was going into surgery. He came into the office. He was going to have a surgery about an hour, and we had somebody who had just had surgery 2 days before. So our surgery day patient was anxious, nervous. He wasn't the same that day. He was just a little more, a little anxiety was showing. So we had the luxury of being able to take him into the room next door. And we said, hey, this guy, they were both obviously willing to share their stories with each other. But this guy just had surgery 2 days ago. Do you want to explain your experience and how you felt on a surgery day and how you are feeling now and the day after surgery? And it was so helpful when people share their experience because it genuinely calmed our surgical patient down. Do you remember how you felt the day of surgery?
Well, I think it's very normal to feel anxious and, apprehensive. But, I knew I was in good hands. And I have to say, Nancy, you were a large part of that because you answered all my questions whenever I sent them to you. And you were very patient and understanding with me, as I'm sure you are with everybody. And you really calmed me down.
That's nice. I'm glad.
So for the whole process, you were my wing lady.
Oh, that's good. I understand. I mean, I've never had facelift surgery myself, but I understand anxiety and I understand it's a big deal to go and do the surgery. We have patients that come in and it's like, yeah, sure, well, I'll do that, as if they're buying, a shirt. And then some people are very anxious and yeah.
She calms the patients down.
She totally calms the patients
She makes
down.
me hyper, but she
Well,
gets the patients.
it's okay,
calm.
as long
I
as
like
she
to make sure
calms
he's
us
on
down.
his game. I'm the co-pilot. So as
You
far
really
as
are.
the recovery, how would you describe the recovery?
Wow. It's unlike anything you imagine. Yes, you're told, I was told, that I wouldn't feel that my face.
You had. Let's
certain
go over
parts-
what you had. So
Okay.
sorry to interrupt you. You had a deep plane facelift.
I did.
You had upper eyelid surgery, lower eyelid surgery,
Yes.
fat grafting,
Yes.
and laser resurfacing
Yes.
of the face, neck, and chest. Is that right?
Yes.
Yeah.
Yes.
Okay. So there we go. So there's a lot to
Which is a
recover
lot
from.
of stuff.
Yeah.
It's a lot of procedures, at least in my mind.
Yeah. Well, a lot of our patients do that combo. It's sort of taking advantage of one recovery, one surgery, one anesthetic, and you try to we don't encourage people to do things that aren't necessary, but if they're trying to rejuvenate everything together in one block of time of recovering, that's obviously the most sort of efficient use of the procedure. And it's also doing multiple procedures doesn't necessarily add that much more to the recovery or the discomfort. So that's why we sometimes encourage people there's obviously like some people are very comfortable just proceeding with whatever we recommend. Other people are nervous and don't want to do too much, so they do the one procedure and then book additional stuff at a later date. Laser goes nicely with, or energy devices goes nicely with the lifting because you're actually improving the skin quality. So that's probably our biggest combo is what you had, the fat grafting, the laser, and the eyelid surgery, because those are kind of the things that change for most people.
Right.
Yeah. So
They're kind of
yeah, they all sort of work synergistically
Yeah,
with each other
yeah.
to improve the appearance. And when we're doing the lifting, different surgeons have different approaches to it, but the general concept is that you've moved tissue from one spot vertically up, and then you're going to get a little bit of crowding around the lateral brow area, and then you may get a little bit of crowding around underneath the eye. And so being able to sort of work on the whole area allows us to sort of tailor everything and try to move everything in a consistent, uniform way to make it look just like it was never done.
What is your explanation to people, or how do you answer people when they say, I just really want to look natural? How do you promise them, or how do you say to them, in consultation, this is how I achieve natural?
It's I don't know if I sort of can answer that straightforward. I don't try to convince anyone of anything. I want people just to have like confidence based on sort of looking through some of our work that we've done. We have quite a lot of actual results on our website, which is probably the best way for you to look at someone's, it's like an artist showing some of their work. I mean, we have hundreds of pictures, especially of facelifts that we haven't been able to share because
that's unfortunate, because there's so many good ones that we can't share.
That sometimes they allow us to share
part.
in the office rather than putting them out on the media. So some of those we have sort of archived so we can flip through. This week we had someone asking me, have I done someone of a certain ethnic group? And I mean, in Toronto, we operate on people of all sorts of ethnic groups. So the surgical approach is not really different. And this operation for different ethnicities, I mean, it's different than eyelids for Asian eyelids or rhinoplasty for African-American patients. There's very specific differences, but for facelift surgery, it's a lot of repositioning and elevating. So the surgical approach is going to be very similar. Maybe there'll be subtle tailoring to people's anatomy, obviously but each case is a case-by-case thing. It's not sort of a racial or ethnic type of operation.
Would you say there's a difference between cases like, I know there are because I work in the office and I see the patients come through the door. Some facelifts, or some facial anatomy is more challenging than others to work with. So what would be a more challenging anatomy versus an easier?
Well, there's anatomic considerations. There's patient overall, genetics and health and lifestyle and things like that. Sun damage.
Oh, we have to talk smoking too.
Smoking and sun damage are kind of the biggest limitations on rejuvenation surgery. So if someone's got tons of sun damage, terrible skin, heavy smoker, we're going to be able to lift the tissues, but we're also going to have to do something to resurface their skin. And also we may highly recommend fat grafting, like what Orly had, just because the fat seems to sort of help rejuvenate some of the tissues that have been damaged from lifestyle and sun. Anatomical factors that play a role predominantly relate to the jaw structure. So someone who's got a very small chin, we may recommend a chin enhancement with a chin implant at the same time as we're doing the lifting. Some people are sort of borderline and they're nervous to undergo the chin augmentation. But in many cases, if someone's got a very small chin, they'll start to notice some of the laxity along their jowls and submental area at a young age, maybe 10 years earlier than someone who has a strong jaw. So
as we age also,
like Jackie Onassis was always viewed as some beautiful woman who went through the aging process without having surgical intervention, as far as I know. But part of her, her anatomy, for lack of a better word, was her strong jaw. And so because she had a nice strong jaw, she didn't get really severely lax until she was much older.
Yeah, Sarah Jessica Parker also with a strong chin, strong
jaw.
Yeah. But as we age, is it true that we sort of recede a little bit, our bone structure?
Yeah.
So that
our
would be
entire
another
facial
reason.
skeleton shrinks a little bit.
So that would explain why some people need some chin structure.
Yeah. We have the odd person who's nervous to do the chin enhancement. They get the facelift and then they may add in some filler at a later date to sort of help give that.
I asked you to put some of my fat into
And fat
my chin.
enhancement.
Because I was nervous of a chin implant
Yeah.
because I found my chin was receding
Yeah.
over time.
It's common.
Yeah,
Yeah.
I did.
Yeah, so there's a few different options available, from filler, fat grafting, or implant, all to sort of address that type of area there.
So, speaking of that area, a lot of women come to us. They want to look snatched. I actually heard a woman today, 59 years old, make me snatched. And I was like, well, we can
New
do our
terminology.
best. And boy, oh boy, I really hope she's got like realistic goals too. So it's really, there's a lot of psychology that goes into facelift surgery. So you want people, obviously, the ideal patient has realistic goals. They want to look as good as they can, but not somebody who's like, in their 70s and they come in wanting to look snatched. It's a little more of a, not achievable. It can be achievable.
Well, one other, sorry to cut you off, but one other anatomical feature, which I didn't really mention, is I mentioned the jaw structure, but one other factor is the hyoid bone. So this is a bone that's part of just above your vocal cords. So you have the thyroid cartilage, cricoid cartilage, and just up here you have a bone that's sort of free floating called the hyoid bone. And there's muscles that run from your mandible, your chin bone, to the hyoid. So if someone's got a very low hyoid, it creates an obtuse, non-snatched look. And
Right.
they'll come in and say, hey, I've never had a good neck. What can you do? And we sometimes see patients as young, and we had a lady in her 30s here with a low hyoid, obtuse neck, almost no neck definition. We see that frequently, and they're looking to look snatched. And those, you're limited by the anatomy, but there are things we can do. So we can't really change where the hyoid sits, but we can work with the muscles surrounding the hyoid and try to elevate them vertically as well in the neck to create some definition. We also can take out some of the tissue under the chin, not so much the fatty tissue that's usually removed with liposuction, but deeper structures like some of the saliva glands, sometimes some of the muscle that lies deep in the neck, to try to sculpt that area so that they actually create a bit more contour, more of the swan neck look. So that's something else that's sort of an anatomical feature. So jaw position, salivary gland, position of the hyoid bone would be sort of three anatomical considerations that are just precursors as to how someone's anatomy of their neck meets their jawline.
And it's really important that we explain all of this to the patients in consultation so they have realistic goals. That's like a big part of establishing realistic goals for the patient so that they come out happy.
One thing that I think is interesting is that whole concept of salivary gland surgery with facelifts is sort of not new, but it's again sort of
Trending.
One of those. It's sort of trending because there's been a number of surgeons in the US who have very big accounts on social media, who some of them are very good surgeons and deliver really nice results. And some of them have implemented this into their practices. Now we have patients seeking it out, asking, hey, do you take out the saliva gland? Whereas there's another entire group of doctors who've been around for decades. I used to go to courses and people would say, we're going to present on removing saliva glands as part of facelift surgery, and the entire panel, say, of expert doctors, almost none of them would agree to it. There'd be like one doctor in the group saying, yeah, I do that occasionally, like 1 or 2 cases a year, where someone's got really low hanging saliva glands, whereas, and others would say it's dangerous and never should be done. There's no indication for it. Whereas now in 2024, you see it being done relatively routinely. And I do implement it, but I use it selectively if I find someone's really got an obtuse, heavy neck, that I am doing whatever I can to sort of give some configuration and shape to their neck. So it's, again, another thing that, the pendulum may swing sort of back and forth as to what's right. I mean, it's fine as long as you don't get a complication, because working in those structures, there's big blood vessels, nerves, and other structures that potentially could be damaged with surgery.
When I'm meeting with patients, they're often asking about the scarring when it comes to facelift surgery. It's obviously something people, especially people who wear their hair up, they don't want to see scars. They don't want anyone else to see their scars. So some people ask, do we do a scarless facelift?
Right. No, it's a great question. And again, some of this has to do with understanding what techniques are available. So we try to divide them up into I'll simplify kind of our approach. So when we're dealing with this part of the face, the front cheek area to the nasolabial fold, I refer to that as a mini facelift. There's still most often an incision. It's going to go into the hair. So there's a scar, but it's totally hidden. Then it goes into the ear again. So it's hidden, but it's not scarless. And then it wraps around the earlobe, and that's a mini lift. Now, if we extend that incision further back into the posterior hairline, that cut's still going into the hair. There's still a scar, but again, we're trying to camouflage it. And we're hoping that some of the hair grows through that scar to camouflage that scar. Not scarless, but hidden or camouflaged. And then the anterior incision also goes into the hair here. So we're trying our best to hide and camouflage. So what is a scarless facelift? A scarless facelift is where the majority of the work being done is through the incisions that I described in the hair. So an incision here, no incision in front of the ear, and then again another incision potentially at the back hair. So what can we achieve through that? Well, you can do a neck lift through this incision, so you can tighten the neck, and you can potentially get some lift in this part of the face. So you've now pulled the neck and pulled that, and this skin has just sort of moved up a little bit. Who's a candidate for that? Well, the jury's not out on it. We find that the majority of patients that are candidates for those types of procedures are younger patients. So someone who's noticing some of the changes in their 40s rather than their 50s. Some surgeons have popularized this and shown some really dramatic, amazing results on patients in their 50s getting that procedure done. But again, it's patient selection. So I'm going to be going in a couple of weeks to visit a surgeon in New York City who does a lot of those procedures, and Dr. Kassir, and I'm curious to see what he's doing because he's a great surgeon, and I'm really keen to sort of see what technique he's doing. I currently do endoscopic brow and mid-face lifting, but I want to see because he's extending it down and doing even more aggressive procedures than what I've been doing. So we'll give you some feedback after that.
And I think that's a wrap.
So, guys, I think we've wrapped it up today. That we've covered a lot of information about facelift surgery. It's a topic that we can even come back and do another episode. But I hope that through this unfiltered discussion with our guest host, Orly, you've learned a lot and given you useful information to help you in your own decisions and journey. And I just want to thank Orly for coming. I really appreciate it. You're a superstar. And we'll see you back on Unfiltered shortly.